Mandatory face masks, capacity limits, and other COVID-19 restrictions are now over.
Here to answer your questions is Dr. Ali Raja, the Executive Vice Chair for Emergency Medicine at Mass General Hospital. Dr. Raja, thank you so much for joining us this morning. This is a major step for the state. We're wondering, do you agree that we're ready for it?
Rondell, I do. Here in Massachusetts and throughout New England, we've really been doing an amazing job with vaccinations, with wearing masks, and quite honestly, with working together over the past year and a half to fight this pandemic. I do think we're ready for it, and I'm glad that we're able to open back up in a safe manner.
Masks are still required for transportation services like the T and taxis, and also, of course, for healthcare facilities. Are there other places where you plan to wear a mask, even though it may not be required?
I think those requirements are really important. The thing is, Rondell, I've got two kids, 7 and 9, and they're not vaccinated yet, and they still need to wear masks indoors. And it's not easy for kids to wear masks. When we're out together, I'm definitely going to be wearing a mask with them, mostly to set an example and make it easier for them. I also know, though, that everybody's risk tolerance varies. And so we're going to see a lot of people still wearing masks, even though they aren't mandated to. And I think that's perfectly fine.
We've seen some protests recently against vaccinations, especially for kids. And I want to ask you about some of their claims here. First one, can the vaccine trigger heart problems, tremors, or blood clots in teenagers?
A great question, Jennifer. The fact is that we just don't know fully yet. We know that there have been some really rare cases of inflammation around the heart, mostly around young men and boys. We've also seen some cases of the vaccines being linked to blood clots in young women after the first few weeks after vaccination. But I think the really important thing to remember is that COVID and other viral infections can also cause, honestly, these exact same diseases. And so the CDC is looking into how much of this is due to the vaccine, how much is coincidental or due to other viral infections. But in the end of the day, the CDC is still recommending that everybody 12 and over who can get vaccinated should.
Okay, follow the CDC. Don't just search the internet for answers. And here's another one. We don't need vaccinations against a virus that is 99% survivable. How do you respond to that?
Rondell, I've been hearing this one for months and months. And I've been talking to my patients about it when they come in, because I think, first of all, I think it's really important not to blow off concerns like this. I think it's important that we address them head on. What's important about this 99% number is that remember that the effects of COVID go far beyond the patients who die from the disease. Their deaths are tragic. We all know people who have been affected, and a lot of us know people who have died. But remember, without vaccinations, the number of patients who get the disease, get severely ill, get hospitalized, strain the healthcare system, it would be exceptionally high, as we saw before the vaccines. And then finally, it's just important to remember that we're still learning more and more about the long-term effects of COVID survivors, on COVID survivors. The vast majority of them wouldn't have been infected at all if he had had vaccines. And that's the reason we need to keep getting vaccinated.